Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that I am MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Shari. For paid online consultation, yes, you can definitely only WhatsApp on 922-6810-630. My dear friends, this is the series going on regarding the common complaints from the patient in general medical practice and how that general practitioner or the doctor should think about the differential diagnosis, different causes of that particular complaint. So today we have the patient of 42-year-old male patient complaining of edema. Let us see what he is telling. So 42-year-old male patient come to the clinic. Doctor, my feet are swollen. My feet are swollen and see that my face also looks like a swollen face since last only 3 days. So the doctor should immediately think of the 3 commonest possibilities of the edema. Please note that 3 important causes should come into the doctor's mind. Number 1, more on the face, edema is there, more on the face, especially periorbital swelling in the morning. Periorbital swelling in the morning, mostly it is a renal edema or the problem due to the kidney. Periorbital swelling in the morning, renal edema or the kidney edema. Okay. More on the legs, especially in the evening, which is called as a pedal edema. Pedal edema may be because of the CCF, heart problem, congestive cardiac failure. More edema is like a middle part, like a patient is having ascites, then that cause is related with the liver, which is called as a portal hypertension. So for the edema, 3 organs should be remembered. Number 1, kidney, number 2, heart, and number 3, liver. For whole body edema, 3 organs are important: kidney, heart, and liver. Okay, let us proceed further, case taking and discussion with the patient. So doctor should ask the patient, is this your edema is maximum in the early morning or when you brush? Yes, doctor, you are 100% correct. See, doctor, I can't open the eyes fully in the morning because of the edema. Oh, okay. So doctor should have in his mind that it may be the renal edema. Then naturally the further question, is your urine or when you pass the urine, is it a little less in amount, scanty, or is it a red colored? Doctor, urine, well, no, it's okay, doctor. No red color, yellow color is there and not scanty. It is okay, doctor. Try to understand. Scanty urine, if the urine is less and red color, that definitely going for the acute glomerulonephritis, acute infection of the kidney, acute glomerulonephritis. But this patient don't have that problem. No red color, no scanty urine. Then doctor should examine the exact edema, where it is and how severe it is. Especially if the pedal edema is there, edema on the feet is there, then doctor should press that edema and see whether that edema is a pitting edema or non-pitting edema. 2 words are there. Pitting means there is a, what I can say, the dick. When the doctor is pressing, it is going inside. Pitting edema and non-pitting edema. Then doctor should see on the calf and all these things whether there are any dilated veins, that is a varicosity is there. After this, after edema, then doctor should go further to check the normal fast quick examination of the tongue. Actually the tongue, if it is a bald pale color, then that is indicating the anemic condition. Then nails, every time I am saying anemia should be checked first for each and every patient. whether the patient is having the cold cough fever, kidney problem, renal problem, any problem, cancer. Anemia is a must to think about, because anemia can obstruct our treatment policy. So you can check the anemia, like for example here, pale color of the conjunctiva. Then you can see the nails, they may be pale, and also the flat, that is platinicia, or the concave, that is coilinicia. Then tongue, bald tongue is also indicating the iron deficiency anemia. So if the severe pallor is there, then if, for example, hemoglobin is less than 5 gram %, that hypoproteinemia or the anemia also can cause edema. Never forget, anemia also gives the edema. Next, doctor can see whether, ask the patient, whether you are feeling, hey, my friend, breathless on walking or climbing upstairs. That is, in medical language, it is called as a dyspnea on exertion. Dyspnea on exertion, that is breathlessness after exertion. After walking, after running, after climbing stairs, after climbing hill. Yes, doctor. If the patient is saying yes, breathlessness after walking, after running, after climbing hill, after climbing upstairs, immediately doctor should check the heart very carefully, especially inspection, palpation, percussion, auscultation. My dear friends, Dr. Deshpande has excellent clinical examination videos. Please check the playlist. Nervous system examination, respiratory system examination, cardiovascular system examination. They are there, videos are there. Superb video, millions of views are there. So please check all those videos, clinical examination. This is also clinical examination. I am saying when the patient is telling that he has a breathlessness, difficulty in breathing after walking, after climbing upstairs, then if the answer is yes, the doctor should auscultate the heart and check for murmur. Murmur is an abnormal heart sound. Lub, dub, normal heart sound, 72 per minute. But lub, dub, lub, dub, lub, dub, lub, dub. This word is murmur. Okay, so the doctor can easily see. Then doctor should see the raised JVP, jugular venous pressure, JVP enlarged here, neck veins. Okay, then doctor also should check the soft liver palpation, and if he finds soft tender liver, it also indicates the case of CCF. Okay, then most important is a pulse. Doctor should check the pulse. If it is a bradycardia, please try to understand. Normal pulse rate 72 per minute. Any patient can check his own pulse. Okay, below the thumb, not here. Below the thumb, exactly. Wrist here. Everybody can feel, not here. Everybody can feel. That is pulse. Normal 72 per minute. If it is more, that is called as a tachycardia, more than 100 after running. But if it is less, that is, say for example, below 60 per minute pulse rate, that is called as a bradycardia. And bradycardia indicates that the problem of functioning of the thyroid gland. If there is a hypothyroidism or the myxedema, then there will be bradycardia. And also the doctor will check the different tendon reflexes. In the myxedema, there will be delayed relaxation of tendon jerks. Then also doctor will check the skin. If it is a coarse, K-O-A-R-S-E, coarse skin, and also hoarse voice. So these 4 things indicating myxedema, then doctor can do for the next investigations like thyroid investigation. Now, the next point is, we must ask the patient, doctor should ask the patient whenever there is edema, are you taking any medicines for any other disease? For example, rheumatoid arthritis patient, they are always kept on steroid, long-term steroid. Why so long? Prednisolone, 10 milligram tablet 2 times a day, 3 times in a day. Sometimes the patient is doing self-medication with this steroid, bronchial asthma patient, rheumatoid arthritis patient, because that steroid, that tablet gives very quick relief, and they are fascinated. Patient is always get trapped into the what you can say the trapping of the steroid. He wants that steroid because he's getting the relief, but excessive steroid can cause, without the medical consultation, if the patient is doing the self medication of steroid, then after few months, after few years, the patient will develop Cushing syndrome. Cushing, Cushing syndrome, excessive steroid, and that Cushing syndrome gives the moon-shaped face, edema on the face. So that also we have to check. If the face edema is of sudden onset, then also one must check the lips. Check the lips. Also, you can check about the voice, difficulty in breathing. I am telling you the 4 things. That is an emergency. Number 1, face edema all of a sudden within 2 hours, within 3 hours. Then there is a swelling on the lips. Okay. Then also voice has been changed. Hoarse voice is there. Patient is feeling difficulty in breathing. Then that particular thing is called as angioneurotic edema. Angioneurotic edema is because of the side effect, complication of any medicine or the drug. That is called as a serious drug reaction or the allergy of the medicine, and the patient should be immediately hospitalized, because breathlessness, if it is increasing, then that can be the problem at home. So better allergic drug reaction should patient refer, angioneurotic edema, refer to the hospital. Now we are discussing the case of edema. So what are the important terminology? Number 1, renal edema. Number 2, myxedema, hypothyroidism. Then the CCF, congestive cardiac failure. Then liver cirrhosis. Then the ascites. Then anemic condition. Cushing syndrome because of the steroid, and the severe allergic reaction of any medicine, that is angioneurotic edema. These differential diagnosis, different causes should be kept by a doctor in his mind when he is having the patient of edema. Okay. So naturally, which investigations? Simple is a urine examination. That can give you the idea about albumin, if there is albuminuria, etc. Then ask the patient to take the salt-free diet. In any edema, salt-free diet, no salt, because salt is hygroscopic and edema will increase. To control the edema, the modern doctors prescribe the diuretics, that is Lasix. Lasix is very well either injection or the tablets, and most of the cases will respond to the Lasix or the diuretic. But if he is not responding in a very short time, then to make a detailed examination, detailed investigation, please refer this edema patient to the consulting physician or MD doctors. Okay. So my dear friends, this is all about the case of edema in our general medical practice, and I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost Dr. Deshpande's energy. I wish you all the best. Take care and see you in the next video. Thank you very much.